Hey, what's going on, guys? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipelines. Visit my website at hairliciously.com to purchase your microneedling device, which is scientifically proven to stimulate hair growth. My low-level laser therapy cap, DHT debulking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. So in today's video topic, I wanted to talk to you guys more about microneedling in conjunction with Minoxidil and Tretinoin, and how you can maximize your hair growth potential with it. I've talked about this topic a couple times on my channel, but not a lot of people who are suffering from hair loss are really incorporating this into the hair loss treatment regimen. So I figured I'd shine some additional light onto this once again, and I'll also show you exactly the steps on how you can use this at home. There seems to be some confusion on what the exact protocol is, so I'll cover that in this video as well. But yeah, as you guys know, the big three conventional treatment that we have that most people stick with, we have finasteride, minoxidil, nicer shampoo. I think the majority of people, at the very least, are using minoxidil. Not everyone is using a 5-AR inhibitor due to, whatever personal reason or adverse side effects, or maybe they just don't want to nuke their DHT levels. But it seems like most people are using topical minoxidil either once or twice a day. Some may notice some good gains from minoxidil while others may not. And this video is more so for those who are not good responders to minoxidil and are looking for ways to really maximize the efficacy. At this point, we already know that pairing up minoxidil with microneedling has resulted in better hair count, better hair density, and better absorption of topicals. There's already, tons and tons of studies backing this up. Microneedling is known to induce epidermal growth factors through the skin wounding regeneration mechanism, which in turn is going to stimulate new hair growth. And the thing is that it's really simple to use. I personally use the Dr. Pen A6, and I've been using it for a while now. You can pick one up for like less than $150, and it's definitely a good investment for those who want to add in another arsenal to treat hair loss. You can also buy one of those derm rollers, but the nice thing about the Dr. Pen A6 and just about any other motorized microneedling device is that the wounding is always going to be consistent, since there's not going to have to be any manual pressure that needs to be applied like there is for a derm roller. And because the wounding is done perpendicular to the scalp and not at an acute angle like a derm roller, it is going to result in far less superficial trauma and tearing of the scalp. Now, it is actually cheaper in the long run to own a Dr. Pen device than a derm roller, since you're going to have to continually, replace the derm roller, while the Dr. Pen only requires that you change out the needle cartridge after a few uses. But anyone using minoxidil definitely needs to incorporate microneedling into their regimen. It's really a no-brainer, as it maximizes the hair growth potential by several folds. And more importantly, if you are using minoxidil, you always need to pair it up with Tretinoin as well. They should just call this, this whole thing like the big 5 or the big 6 or whatever. So Tretinoin is something that I've been using for a while now. It's a vitamin A derivative, and it works extremely well in treating, facial wrinkles, treating acne, dark spots, sun-damaged skin, and more importantly, it helps enhance minoxidil response by upregulating sulfotransferase enzyme activity. I'll be going over a few studies on minoxidil and Tretinoin, and then I'll show you exactly what you guys can do at home to incorporate this treatment into your hair loss treatment regimen. This first study is titled Influence of Tretinoin on the Percutaneous Absorption of Minoxidil from an Aqueous Topical Solution. 19 healthy male volunteers completed a 3-way randomized crossover study to determine the effect of the synthetic retinoid Tretinoin on percutaneous absorption of minoxidil. Subjects received for 20 days twice daily administrations of 1 milliliter of an aqueous 2% topical minoxidil solution, either alone with once daily application of a 0.05% Tretinoin cream, or with once daily applications of a vehicle control cream. When minoxidil was co-administered with Tretinoin cream, minoxidil absorption was increased nearly 3-fold, compared with a 1.3-fold increase in absorption observed with co-administration of vehicle control cream. Transepidermal water loss measurements, which are sensitive to changes in the stratum corneum function, were also significantly increased with Tretinoin. No treatment-related changes in stratum corneum thickness were observed on the basis of skin biopsy analysis. The findings indicate that percutaneous minoxidil absorption is enhanced by Tretinoin as a result of increased stratum corneum permeability. So 3 times better minoxidil absorption is a pretty significant change. And for those who are already responders to minoxidil, they can just still throw on tretinoin and experience even better minoxidil absorption, which in turn can theoretically result in higher hair count and higher density. And the thing is that tretinoin is readily available via prescription. I actually got mine from a local dermatologist, and the concentration varies. The one that I have is 0.025%. It goes upwards to like 0.1%. Dermatologists also gave me the option to bump it up to 0.05%. But as the concentration goes up, it also increases the skin sensitivity since it pulls oils and dry skin cells away from the skin. But I would definitely recommend at least 0.05% and 0.1%, like most studies indicate. There appears to be better efficacy as the concentration goes up. So in another study titled "Tretinoin Enhances Minoxidil Response in Androgenic Alopecia Patients by Upregulating Follicular Sulfotransferase Enzymes," 43% of subjects initially predicted to be non-responders to minoxidil were converted to responders in just 5 days of 0.1% topical tretinoin application. And this is important because the test the study uses to measure the follicular sulfotransferase enzymatic activity in the plucked hairs as a method to predict minoxidil response demonstrated an accuracy of nearly 98% in identifying non-responders to minoxidil. So in just 5 days, application once a day of tretinoin cream suggested not only enhanced systematic absorption of minoxidil, but also an increase in sulfotransferase enzyme activity. And this is key because in order for topical minoxidil to be efficacious, it has to be converted from minoxidil to minoxidil sulfate through the sulfotransferase enzyme. And if you have low levels of this enzyme, you're not going to respond well to minoxidil. So I'm going to give you guys a quick illustration on how you can use tretinoin and minoxidil and microneedling together to upregulate your sulfotransferase enzyme activity and also to increase the absorption rate of minoxidil, because a lot of you have been having questions on exactly how to do this. So on the day that you guys microneedle once a week, make sure to do that first. I recommend that you guys always wash your hair and just dry it completely prior to and after microneedling, because there's a lot of sebum production and oil buildup on the scalp, and if you don't wash it, the needles, it will be harder for them to penetrate into the scalp. And also for whatever topicals that you guys are using, it's not going to be effective due to all that crap that is caked on your scalp. So after you clean your scalp, proceed with microneedling session with a derma roller or a derma stamp or Dr. Pen, Derminator, whatever. Most people wait 12 to 24 hours after microneedling before applying any topicals like minoxidil. But there are some people that just do it right away. Some experience side effects while others tend to be okay. So do this at your own discretion. Typically, if you do it right after microneedling, it tends to go systemic, which can cause unwanted side effects. So that's why I kind of recommend that you guys wait about 12 to 24 hours after microneedling before you apply any type of topical. After about 12 to 24 hours of microneedling, you want to grab your tretinoin cream, squeeze out a small pea-sized amount on your finger, and you guys are going to rub it on areas that you'll be applying minoxidil. You want to rub it on thinning areas. The study that I referenced actually applied 2 milligrams per centimeter squared on the target area. So depending on the area and degree of hair loss, you may or may not need more. Make sure that you try not to get it on the hair too much, because it is a thicker base cream and it's going to require that you kind of really rub it in to fully absorb and dry out. Now, after tretinoin application, you want to wait about 20 to 30 minutes to let it fully dry before you apply minoxidil. And finally, once it is all dry, you can then apply topical minoxidil into the scalp, let it dry, and then go about your day. I also recommend that you do this at night because tretinoin can make the skin sensitive, especially when it comes to sunlight. So it's better to do this when the sun's not out. It's also recommended to apply some moisturizer because both tretinoin and minoxidil will dry out the skin. Now, I will say that there are pharmacies that also compound the minoxidil with tretinoin and other drugs like finasteride together so that you don't have to kind of do it separately. So if you do find that to be more convenient, I would recommend going that route. I've read of others who just kind of get like a small amount of tretinoin cream and they mix it with either 1 or 2 milliliters of minoxidil solution in a little container. And then they apply it topically so that it gets rid of the hassle of, like I said, just doing each application separately. To be honest, I don't know which one is better in terms of efficacy or more stable. They're probably all the same or similar in my opinion, but At least in the US, most dermatologists will prescribe the cream version when it comes to tretinoin. So it's probably better to do it like the study suggests and then apply the topical cream on the scalp, let it dry out for 20 to 30 minutes, and then apply minoxidil. It's a relatively cheap and simple regimen that anyone who is already using minoxidil really needs to incorporate. I believe I paid like $5 for this 20-gram tube of tretinoin through my insurance. Side effects from tretinoin are very mild, and it's usually, if any, it's due to mild, thermal irritation. So it is a relatively safe drug with a good safety profile to use in conjunction with other treatments that can help maximize your sulfotransferase enzyme activity while also promoting better absorption of minoxidil. People who are already seeing good results should still use it, in my opinion, to even further their results and gains. And you really have nothing to lose. I recommend that you try it out if you haven't done so, and I'd be really happy to hear about your results from it. But that wraps up this video. Hope you guys enjoyed it. Let me know if you have any questions. Thanks for watching. Thanks for all of your support. And I will talk to you guys in my next video, which will actually be announcing the lucky winner for the hair transplant at Cosmetica in Turkey. So stay tuned for that. I'm really excited to let you guys know who has won that drawing. But thanks again, guys, and I'll talk to you guys next time. Take care.